all patients will complete a phone pre-op anywhere from 3 to 4 weeks prior to surgery. And then the day before surgery, we will do an in-office pre-op appointment. During that appointment, we're going to give you your surgery time. We do ask that you arrive 1 hour before scheduled time. No eating or drinking after midnight. You can brush your teeth, just don't swallow any water. You need to bring your caregiver with you, and it's very important that your caregiver know that they need to stay within 20 minutes of the facility while you're having your procedure done. They will fill out a caregiver consent form saying that they agree to take care of you while you are recovering from your surgery. The caregivers are able to go with you into the pre-op room during the morning of surgery, and they're also going to be called into the recovery area. So be sure it's someone that you're comfortable with and someone who you trust with your post-operative care. We do ask that for the day of surgery, you do not wear any jewelry, any makeup, any fingernail polish, and that you don't bring any valuables with you. Please wear dark colored, comfortable clothing. You want to wear something that's loose fitting, something easy to get on and off, and something that you don't mind getting a little dirty, just in case your drains leak a little bit. The morning of surgery, we also ask that you shower using antibacterial soap. So like a Dial or a Hibiclens is perfectly fine. And if you need to shave any areas of your body, do that the day or two before surgery and not the morning of surgery. During your pre-op appointment, we will get you consented for all of your procedures. We'll go over what to expect the day of surgery, some things to expect post-operatively, and most importantly, we'll also be giving you all of your prescriptions as well. During that appointment, you will meet with a nurse practitioner, and we will also get some preoperative photos that we'll use as your pre-op photos for your chart.
Before the morning of your surgery, please be sure to read over all consent forms and post-op instructions, write down any questions or concerns that you may have, and review all hormone replacement and birth control guidelines. This is very important.
The morning of surgery, when you arrive at the surgery center, your caregiver will be given a caregiver consent form to fill out. They will bring you a basket, and in that basket it'll have a gown, it'll have some compression pantyhose, it'll have a bonnet for you to cover your hair, and a cup for a urine specimen for all of our female patients so that we can do a pregnancy test. Once you've dressed out and given your urine specimen, you'll be taken into one of the preoperative rooms. In that room, you will meet with a CRNA. That's the person who administers your anesthesia. They'll go over some medical history questions, get you consented for your anesthesia, and get an IV line started on you. After that, Dr. Jimerson's going to come into the preoperative room. He'll verify all of the procedures that he's going to be doing, and he will proceed with marking your body. And I know that some of you follow him on social media, so it'll be just the way you see there. He'll mark all the areas that he'll be working on, and he'll be more than happy to answer any questions about your procedure that you have during that time. After Dr. Jimerson has finished marking your body, you will be taken into the operating room, and your caregiver will be walked out to the lobby. Once you're all done with your surgical procedure, your caregiver will be called to come back into the recovery area. The recovery nurses will go over with your caregiver what to expect post-operatively. They'll show them how to take care of your drains, how to administer your medications, how to position you, and so forth. They'll give them all the information that they need to contact us in case if you have any questions or concerns post-operatively as well during that time. You can expect to be in the recovery area for at least an hour to an hour and a half. You'll be given several prescriptions during your pre-op appointment, and some of those prescriptions include an antibiotic, a stool softener, a muscle relaxer, pain medication, of course, a blood thinner that is an injectable form. You also have an anti-nausea pill, and you'll have a couple of medications that you'll be given for the morning of surgery. All of your prescriptions will be labeled as such, and the ones that you need to take the morning of surgery you'll take as soon as you wake up that day. Now, some things to expect post-operatively, the most common things, of course, one of them is pain or discomfort. Most surgical procedures, you'll have some pain after surgery. We do provide you with enough pain medication to keep you comfortable, and also muscle relaxers as well for those patients who are having liposuction procedures. The medication you normally will take every 4 to 6 hours during the first week of your procedure, and you can slowly start to wean off of your medication as you start to feel more comfortable. Some other things to expect post-operatively, the most common thing is swelling after surgery. Swelling can last anywhere from 6 months to a year. Every patient is different and everyone heals differently. So we do have you wearing compression, and we ask that you wear that compression for at least 23 hours a day for the first 6 to 8 weeks after your procedure. After your 6-week post-op, we'll talk to you about weaning out of your garment and wearing it a little bit less. Do keep in mind that with every patient it is different. Everyone heals differently, so we try to keep your post-op instructions individual to your needs and your recovery as well. A lot of patients experience numbness and tingling in their fingers after surgery, and that is perfectly normal. It typically subsides on its own within a few days. Sometimes it can take a little longer. You may also have numbness and tingling in your liposuctioned areas. This also will last different amounts of time for different patients and will subside on its own with time. Your nerve endings are going through a healing process, so it is different for everyone as far as how long that will last. Some patients have a little bit of a sore throat after surgery. You are intubated while you're asleep during your procedure, so you can gargle with salt water or take a throat lozenge after surgery to get rid of some of that discomfort for you. For patients who are having fat grafting to their butt or to their hips, we do ask that you do not do any sitting for at least 2 weeks after surgery. After your 2 weeks, you should use your curve cushion pillow. That pillow should be used anywhere from 6 to 12 weeks after surgery. The longer you use it, the better. It will maximize your results and allow for the fat that's been transferred to heal in that area so that you're not harming that blood supply while it's going through the healing process. Most patients experience constipation after surgery. It's a combination of your pain medications and the anesthesia. So we do ask that if you haven't had a bowel movement in the first couple of days after surgery, that you start to use a laxative or enema to help your body to eliminate the bowel so that you don't have any further complications with that after surgery. We do provide you with a stool softener, but that just won't be enough. So you may need to get an over-the-counter laxative or an enema as well. You're able to shower after surgery for most procedures. However, if you have a procedure where there are large incisions, such as a thigh lift, a tummy tuck or abdominoplasty, or breast lift, we ask that you sponge bathe during that first week because we want to keep your steri strips clean and dry. For those patients who do not have large incisions, you are able to shower after surgery, but we ask that you cover your drains with a waterproof cover. Some patients will purchase waterproof covers from the pharmacy, or they'll wrap saran wrap around them. Either way, we want to prevent any water from going inside of your drains or from wetting any of your steri strips. We provide you with compression socks to wear during the week of the first week of your recovery. We do ask that you wear those compression socks for the entire week, as well as for your travel home if you live out of state or out of the metro Atlanta area. Also, anytime that you do any traveling over the next 3 months, if you'll be traveling by car or by plane for over 2 hours, you should wear compression socks for that as well. Your final results. Every procedure is different and every person heals differently, but for most procedures you will not see your final results until anywhere from 6 months to a year after surgery. Allow your body to heal and go through the processes. We're here to help you along the way and answering any questions about that healing that you may have, but most procedures do take at least 6 months to a year for you to see your final results. So just be patient, follow your post-op instructions as given, and look forward to that good result afterwards. A very important part of your post-op, especially with liposuction, is having lymphatic drainage massages done. We typically recommend that you have a minimum of 3 lymphatic drainage massages done during the first week while your drains are in place. However, you will need to massage throughout all of your healing process. Having a lymphatic drainage massage helps to minimize your swelling. It also helps to remove fluids from your body and soften the skin. These are a little bit uncomfortable in the beginning, but they feel very good once you're toward the end of them. They will help you heal a lot faster and help get you closer to your results a lot faster as well. So with the lymphatic drainage massages, basically the purpose of them is to remove any excess fluid from your body, which in turn also helps to minimize the swelling. It also helps to eliminate any hard areas or lumpy areas after surgery. Your lymphatic system's been disrupted during your surgical procedure, and sometimes it takes a while for it to heal. So these massages help to eliminate these fluids to help your body remind itself of what it's supposed to do to help you heal better. So it helps to kind of speed up that process for you and to keep that swelling down to a minimum so that we can get that result a lot quicker. Another very important part of your recovery is resting. It's very important that you allow your body to rest. After having surgery, you may feel like you are ready to get back into your norm, but it's very important that you allow your body to rest and to heal after your surgical procedure. It's very important that you eat well. It's recommended that you eat lots of protein, so maybe a lot of grilled chicken or grilled fish, lots of fruits and vegetables, and hydration is extremely important as well. You should drink a minimum of 64 ounces of fluid a day. And if you can incorporate some other fluids in, like Gatorade or things with electrolytes in them, such as Pedialyte, those things help as well. You will need to drink in order to recover well and to help your body to heal and get back to normal sooner. If you have a surgical procedure that involves surgical incisions, you're able to start applying scar creams anywhere from 4 to 6 weeks after surgery. We want to be sure that all of your incisions are closed and healed before you start applying the scar creams. There are a variety of scar creams available. None really need a prescription. You can get most of them over the counter. Some help with flattening the incision area. Some help with lightening the scar as well. So we can give you different options as to which ones to use as well. We want for you to avoid any smoking. If you had any type of fat grafting, any type of incisions, just any of our major surgeries. You want to avoid smoking or being around secondhand smoke. Smoking can hinder the healing process. It can affect how your incisions heal. It can burn off the fat if you had fat grafting. So we want for you to avoid smoking. We want for you to avoid being around secondhand smoke. You also need to avoid any alcohol consumption 3 to 4 weeks prior to surgery, as well as 3 to 4 weeks after surgery. Alcohol has blood thinning qualities in it, and we just don't want that to interfere with your healing or with the medications that you're taking as well. Most patients are able to resume light exercising 4 to 6 weeks after surgery, and of course it is depending on the procedure that you're having done. We do ask that if you have any fat grafting done, that you wait at least 3 to 4 months before you do any type of cardio or fat burning exercises, as that can burn off some of the fat that's been transferred. We would like for that to be healed before you start to burn that off. Most patients do experience what we call an emotional roller coaster after surgery. It's perfectly normal. You have a team behind you, a very large team that's here to help you and to answer any questions that you have post-operatively. So while you may feel a little down on some days or be a little confused about your healing process, you can always give us a call and we'll be more than happy to help you with any of those questions. So just know that we're here for you.